Welcome to Science, Health and Healing Library of Children's Health Core. I'm Dr. Majid Ali. The subject of this article is your doctor thinking? Part 2. If you have a blood test done with your doctor and the creatinine value is 1.5, creatinine, creatinine. It is the single best test for the beginning stages of kidney failure. If you have a creatinine value of 1.5, you are on a path to dialysis. If your doctor looks at this value and does not talk about it, your doctor is not thinking. I know this is a very ungracious, perhaps unkind way of raising this question, but as long as I continue to see patients who are never told they have kidney failure, they're on the path to dialysis until their creatinine goes to 5, 6, or 7, and they're told, we have to give you a surgical procedure to prepare you for vein access for dialysis. As long as I continue to see those patients, I think I have a right to continue to warn at least the viewers of this Science, Health and Healing Encyclopedia. So, if your creatinine value is 1.5, indeed normal value should be 1. Even if you go to 1.3, your doctor should tell you this is the early sign of kidney failure. You don't reverse it, you will develop high blood pressure, heart disease, eventually you will end up on dialysis for life. So if he doesn't bring these things up, that doctor is not thinking for himself or herself. The consequences of his inability to think independently are devastating for you. He doesn't bring it up because he thinks kidney disease is not reversible. That's most unfortunate because even the New England Journal of Medicine, putatively the most prestigious medical journal in the United States, published an article in year 2003. The first author was Lin, L-I-N, clearly showing that creatinine values can be brought down by EDTA chelation. 1982, collaborating with my colleague, Professor Alfred Fahmy, Professor of Pathology at Mount Sinai School of Medicine in New York, I published the first textbook of pathology of maintenance dialysis. Professor and I have authored a very large number of original articles published in such prestigious journals as the Journal of American Medical Association, Lancet, Archives of Pathology, Kidney International, American Journal of Cardiology. So I'm not taking cheap shots at your doctor if he does not warn you that you are on the path to dialysis because your creatinine is rising and he does not bring it up. His negligence will cost you dearly. Look at other segments in this series. Is your doctor thinking? Then send me an email, aliacademy7@gmail.com. Tell me, Dr. Ali, you're really into cheap thrills. Dr. Ali, you really are caught up in self-aggrandizement. Dr. Ali, you're being very uncharitable to your doctors in your profession. See if I have gone over the board. Or see if my cries for attention to detail, doctors, they went to medical school because they had passion for healing. They must pay attention. They must care. A doctor who ignores a creatinine level of 1.5 to 2.5, I told you amazingly I see patients with creatinine value of 3.5 and they don't have the foggiest idea that they have kidney failure. They've lost close to 85% of their kidney function. They are on the path to dialysis. Their doctors never brought it up. So you decide. Children's Health Core was funded and founded by Talat, my wife, and I some years ago with a vision of providing authentic, free of cost information for children all over the world. For children, teenagers, adolescents, parents, teachers, grandparents, and hopefully some public health policy makers and governments. Support our vision. Please forward this YouTube segment to your email, Facebook, Twitter, LinkedIn contacts. Please visit our website www.kids123.org, kids123.org. There is a link on the front page. It asks a question, how can I help? If you raise this question, we give you specific concrete suggestions how you can join hands with us, how you can participate in our effort to really provide authentic understanding. For understanding to be authentic, it has to be liberating. That's the criteria that we use. Until we meet again, may you be gracious, graceful, and generous in your spirit. Please do look at other segments in this channel. Is Your Doctor Thinking? Thank you.